Thank you for stimulating our appetite.
And thank you, Dr. Panda. Your medication really worked. Thank
you. So many tasty dishes that you have projected. Thank you, Professor Misra. Dr. Misra, thank you for chairing these 3 sessions. Now I invite Dr. J.B. Kanwar, our young endocrinologist, to moderate the panel discussion. We have with us Mrs. Shilpa Joshi, one of the famous dietitians of the country, and Miss Monica Behra. She is also a dietitian from Dr. Kanungo's Diabetes Center. So our panelists are Dr. Monica Behra, Dr. Cyril Salis, Mrs. Shilpa Joshi, and Dr. Sharma. And I request Dr. J.B. Kanwar to moderate it, please.
Very good afternoon to all of you. Thank you, Alok sir. We all of us know that the first thing in our prescription we do is always write a diabetic diet of 1600 or 1800 kilocalorie diet, but we do not put lots of emphasis on actually explaining the patient what diets he or she should take. And I am actually thankful to Alok sir, Dr. Jayant Panda sir, Dr. Sukh sir, that they have rightly chosen this topic, nutrition in diabetes, and we should be discussing more about diet. And we all know that that's a very important aspect of glycemic control. So today we had very good discussion, presentation by Dr. Cyril and Dr. Dharini, and also as a good interview with Dr. Sharma. Today I'll start with this panel discussion with some of the common questions. If you look at the presentation by the different dietitian, or if you look at the presentation by the doctors, they speak about the 50%, 60% carbohydrate, 20 to 30% protein, and 15 to 20% fat. These are not very something like not very take-home kind of message. So I plan to ask few of the commonly asked questions, and people actually, the caregiver, the physician, and everybody wants to, even the patients wants to know regarding those questions. So my first question to Dr. Shilpa Joshi, what is the best kind of oil you should use or prescribe in diabetes? I know this has been asked too many of the times to you. And what are the oils the diabetics should be taking, and what are the oils they should absolutely be avoiding?
Okay, so first of all, thank you, Dr. Alok, for inviting me here. So using dietary fat is a very sort of $1 million question. I think it comes to you from every patient, it comes to you from even people who are not patients. So the first and foremost thing is, in diabetes, it's very important, whichever fat you use, you have to use it in a prescribed amount. So I want to make that very clear that most of the studies you will see talk about 30% calories coming from fat, and therefore try to use limited amount of fat what you're using. I'll come to the quality first. Let me talk about the quantity. So 20 grams of fat, that is 4 teaspoons of oil, ghee together. Whatever fat you're using, 4 teaspoons per person per day. That's the first thing. Second thing is the choice of oil. So which oil to buy? Typically, according to AHA recommendation, most of your fat calories should come from monounsaturated fats. So which are those oils which are rich in monounsaturated fat? So peanut oil, rice bran oil, mustard oil, canola oil, sesame oil. These are oils which are rich in monounsaturated fat, and hence you can consume them as cooking fats. As far as pardon me, fats which are rich in polyunsaturated fats like corn oil, curdy oil, sunflower oil, safflower oil, all these oils go because if you look at their data is very robust for prevention of heart disease. But what happens is, Indian cooking methods utilize heating of oil. We give a tadka to everything that we cook, where the oil is taken to very high temperature. And at that point, polyunsaturated fats are not stable. And therefore, cooking oil should ideally not be polyunsaturated fat, which is corn, sunflower, safflower, and so on. It should be a monounsaturated fat because it's more stable to be heated. So that's answering both the questions.
Yeah, very well answered. What are the oils we should avoid? What's your comment on the coconut oils?
So
Because
again, there are a couple of studies on coconut oil and the data is conflicting. It is not very clear whether you should or you should not. My understanding is there are certain cultures across India, for example, Kerala, for example, certain parts of Karnataka, where they use coconut oil primarily as a cooking fat and they do not use as much ghee like it's eaten in North India. So that portion of ghee, which is about 1 teaspoon, they can replace it with coconut oil in certain kinds of foods, not everything. So it shouldn't be the primary cooking medium. That's what I'm trying to tell you.
correct. So I think the take-home message is you have to mix different kind of oil in
but
your
not physically mix it.
Obviously,
yeah.
differently.
No, people physically mix it, and that is why people will physically mix it. So the suggestion is make different things in different oils.
Correct.
Keeping the quantity constant.
Correct. I appreciate your answer. And second most important questions being commonly asked by the people or the diabetics is what kind of sweetener we should use. Many sucralose, aspartame, stevia, so many things are available in market. Which is the best sweetener for use for a diabetic patient and how much we should use?
So
what is the recommended amount?
Like I said, like you said, there are many sweeteners in the market, and about most of the sweeteners which are in the market are all approved under FDA, under the category of GRAS, generally recognized as safe. So they all have a ADIs, that is acceptable daily intake amount. And as long as you are below the ADIs, you are fine. After saying so, one has to remember a very important thing, that sweetener should be ideally used as a tabletop sweetener. What does that mean? You can sweeten your teas and coffees and milk and sharbat with it. But if you start making mithai out of it, that is not good, not because you reach ADIs. That's not the problem. The problem is mithai, one component is sugar. Maximum component is fat. Laddu banana hai to ghee hai, kuch bhi banana hai to ghee hai. Correct? So I think that's a big problem, and therefore that is something that you have to keep in mind while you are using a sweetener. So use sweetener as tabletop sweetener. All sweeteners at minimum amount are acceptable. We really do not have long-term studies. This is all anecdotal, that sweeteners cause whether memory loss or cancer or whatever. That is not, that it's not proven. There are no long-term studies to prove it, and therefore whatever sweetener you want to use, just use it as tabletop sweetener rather than using it to create recipes.
Correct. What would you choose? Sucralose, aspartame, stevia? What would you choose one?
So
if you want to
what are you doing with it depends. So for example, because aspartame is a dipeptide, it is heat sensitive. So suppose you are going to say, put it in something hot on the flame, it's going to denature and there won't be sweetness. So if you're using it when it's being cooked, then you want to use sucralose. When you're using it in something, for example, ठंडा दूध है उसमें डाल रहे हैं, या चाय गैस पे, मतलब कप में चाय है उसमें डाल रहे हैं, then you can use aspartame unless there is a problem of phenylketonuria. Then you can't use aspartame. Otherwise, you can use stevia. The only problem with stevia is it has a very strong licorice flavor. So a lot of times it's not acceptable to people who consume it. They say aftertaste bahut zyada hai.
Correct.
I'd like to ask Dr. Ms. Sari that do you think MNT for diabetes is different from diabesity?
No, I think it is. I think it is the same. As I said, it's not a one size fits all. We would definitely take the diet recall, look at the anthropometrics, look at the body composition, look at the blood investigations, and then plan the diet. I think it's very important to personalize. It's all about tailor making. Like my outfit may not fit somebody, and therefore it has to be tailor made. And similarly, even the diet has to be tailor made. And the same principles apply. It's about moderating carbs, improving the protein, and adding fiber and good fats to the diet.
So, what are good fats?
I think Shilpa has already spoken about it, but I would say Nuts and seeds are good fats to add into the diet, and especially like I said, that evening snack of people think that biscuits, usually they wake up to biscuits, they need that morning chai also, they need to dip something crisp into it and then have. So one is we have to give them healthier options. Shilpa has already spoken about the different kinds of oils, and in addition to that, the nuts and seeds, especially when we are moderating carbs and we do not have the our target is not weight loss, because not necessarily every person with diabetes is having a high BMI. We do have lean people with diabetes as well, and therefore important to look at the body composition. And if you want to still meet the calories, the best thing to do is nuts and seeds. Again, looking at the pocket of the person, you can choose what is best. Somebody who cannot afford your almonds and walnuts and pistas, peanuts become a good option. And again, we've done the maths. One almond is 1 rupee. So, you can replace that cutting chai, which is maybe 10 rupees, or a samosa, which is 15 rupees, with 15 almonds. It'll give you a lot of health benefits, as well as you've moderated carbs, you've added the important nutrients to the diet, as well as added good fats.
Dr. Kamar, please.
Yeah, Monica, I do. Usually, people say you should use fried chicken, or you should not use fried chicken or fried fish. Fish, you should mostly use grilled chicken or grilled fish. Why is that? What is the advantage of grilled chicken and grilled fish over the fried one?
Good evening, all respected dignitaries. Thank you, Dr. Alok Kanungo sir, for giving me this opportunity. Basically, like roasted or grilled chicken or fish preferred over fried one is just because due to its fat content, as fried chicken has higher calories count to high volume, and as well as like the grilled chicken tends to be slightly healthier fat content, just because we doesn't use into a deep frying process.
Okay. Is Dr. Dharini is there? Still there?
No.
She's not there. Okay. My next question is to Cyril. What is the advantage of brown rice over the polished or white rice?
The fiber content as well as the glycemic index. So brown rice, there is a lot of studies, especially done by Dr. V. Mohan's team, that the GI is lower, the amount of the fiber content is higher, and it gives faster satiety. So that would be an advantageous thing to do. And the only thing is the cooking time is slightly longer, especially if you're using the brown rice. The cooking time would be a little longer. So that is something that they need to factor in. Unpolished rice, that is absolutely, the fiber content is low, and it would spike up the blood glucose levels. Again, it depends on the variety of rice. We have so many different kinds of rice available in the market, and therefore brown rice would be a healthier option. Nowadays, you get red rice or you get parboiled rice, that could also be eaten. But again, everything has a similar amount of calories and carbs. So even if you're eating brown rice, you still need to moderate the amount that you are eating.
Yeah, there are places in India where they usually take white or polished rice. They do not take this brown rice, or traditionally they take polished or white rice. So, what are the measures you should suggest so that can reduce the glycemic index of this white or polished rice?
One is definitely adding a lot of protein and fiber, and I think your diet is extremely healthy, especially if you look at the East Indian diet. I'm a big fan of their diet because you all use the healthy fats, you all use mustard oil, you all use vegetables. In fact, even your non-veg items have got vegetables in it, a lot of greens, etc. So it's a very, very good nutritious diet, and if you follow the food order, I think that really helps. And we've seen it in our own clinical practice, it helps. Also about resistant starch, where you cook the rice one day prior, keep it in the fridge, and then just warm it slightly, not make it very hot. The RS content goes up, and that could also add to the benefits.
Monica.
But otherwise, I think your diet, especially even panta bhat, is something that I advise all my people, especially from East India, and they feel so happy. Or pakala, it is so good. And today we're talking about its gut-friendly benefits, and they feel so happy that, we're advising them to eat it. So that is why it's very important. I think even if I am sitting in western part of India, I should know the diets of different parts of the country so that I can then make it customized to what they are eating. I remember having a South Indian patient who reached out to me and said, should I eat a khakra every day? Because I've not been brought up eating it. and I don't like the taste of it. But just because the nutritionist was in a part of a country where that was her, daily thing. She used to have khakra every day, so automatically it goes into the meal plan, and therefore it has to be customized. And I think regional preferences definitely have to be taken into account. And
thank you. Our next question to
and suggestion for Dr. Kanungo to keep Pakhala Bhata as a menu in the next physical NUCD meeting.
I would love it.
We'll make it. Both non-veg pakhal and veg pakhal.
Pakhal with sukwa, sir.
My next question to Miss Monica Behra, that whether milk or dairy products are allowed in diabetes patients, and if allowed, how much amount is allowed per day?
Yes, sir, it is definitely allowed it. Like in current evidence, this indicates the higher consumption of milk products, which is associated reducing risk in developing type 2 diabetes. Both lower fat and higher fat both plays a major and beneficial role in preventing or protective way in pre-diabetic stage. Basically, it is very useful to consume milk or milk products, especially yogurt and cheese, which appears to be very protective against type 2 diabetes. Yes, sir. Then it is daily recommended. Okay, so it is recommended to consume half liters of 500 grams of milk and milk products per day for every diabetes and non-diabetic patients.
So out of that, you will have yogurt, cheese, and everything out of 500 of them.
Yes, sir, including every milk and milk products, both.
In renal cases, we will have to restrict it or not?
Yes, sir, definitely we have to restrict, because in milk and dairy products, we get much amount of protein, and in renal cases, we have to reduce the protein content. So basically, we can, depending on the parameters, we can give them the supplement of milk.
Yeah. If Dr. Silpa is still there, I don't see.
I'm there.
Yeah. People always ask whether to take the whole fruit or to make a juice out of it without adding any sugar. What would you recommend?
No, always a fruit, never juice. Always a fruit.
People say we are not adding sugars. So
it is not about sugar. It is about loss of fiber.
Correct.
And it is about increasing the portion size. So if you eat an orange, you eat 1 orange. To make a glass of orange juice, you need 3 oranges at least.
Correct.
If they come from Nagpur, if they are growing somewhere else, you may need 4 or 5. So therefore calories increase.
Absolutely. And what about the nuts or almonds, using nuts and almonds?
So like Cheryl said, it's very important that in any diet for any metabolic issue or even for good health, there should be liberal consumption of nuts and oil seeds, because they give you very quality fat and very good quality of antioxidants and some amount of protein, and they are very low in very low in carbohydrates. And hence, it is very important that they are consumed, but because they are high in calories, again restricted to 20 to 25 nuts in total. They can be a mixture of many nuts. So some almonds, some walnuts, some pistachios. Now we have study from Dr. Mohan's group to show that even cashew nuts are good. So there can be some cashew nuts. But I want to say one thing. In India, when we talk about nuts to our patients, they are called as dry fruits, right?
Yeah.
Remember, dry fruits are fruits which are dried. That is raisins, apricots, figs. They increase blood glucose. So they should not be consumed. Only nuts should be consumed, because for patient, everything is dry fruit because it is sold in same shop. But they are two different things.
Dr. Kanwar, I have a question to ask to Silpa, taking cue from what you had asked.
Yes, sir.
You rightly said that juice is better, is worse than the full fruit. And you also said, you educate the audience regarding the same thing. Say potato is bad, but smashed potato is worse than a full potato. So that the form in which we take the food matters. Am I correct, Silpa? The form in which we take the food. So would you dilate upon that? People take in various forms the same food. So the very good question Dr. Kanwar had asked about the full fruit and versus juices. Similarly, you give some other example of the same fruit which is good in taking as a whole, and not as a not as cut into various form, like a smashed potato is worst form of carbohydrate. Am I correct?
Yes. Yes. So, very important point, sir. We talk about processed foods. And it is so much of it is spoken about eating whole and not eating processed. And every time we talk about processed, we only think of pre-packaged food. But fruit is processed, right? You're cutting a fruit, you're processing it to produce juice. Okay, you're taking a potato, you're boiling it, mashing it to make into a mashed potato. So processing need not always be in a factory. Processing can be right in your kitchen. And that is why eating certain amount of whole foods, like that is why salads, whole pulses, they are so important. Millets, because you are processing them minimally. And I think that is something which should be understood. Namkeen jo ghar mein banta hai, matri and laddu, this is all processed food. You don't have to go anywhere to buy it. It is made at home. So I think that is something that has to be understood.
I have one more question at Convar, since Dr. He is not here. Dr. Sharma is possibly not here. I want to ask that he discussed about.
There, sir.
I am here, sir.
I didn't see you have made your this thing of Dr. Professor Sharma. So I just wanted to ask you, sir. You said 3 ways of reversing diabetes. One, you said about the bariatric surgery. Other, you said about the very low carbohydrate diet, and also something regarding the carbohydrate-free diet. Now, which one? I mean,
2 minutes more.
2 minutes. I'll take only half a minute. Which one of these 3 is most affordable in Indian population?
So the most effective and in long term, the most economical will be bariatric surgery in a morbidly obese patient. But what we see in our day-to-day practice, these are the patients who are having, let's say, weight which is overweight or lower range of obesity. In that, we usually prefer to have dietary modification, as our dietitians here highlighted, that you have to modify the diet and then you reduce the weight. And the effect of exercise is not highlighted in this weight reduction and reversal of diabetes. What they say is that you first reduce the calories. Once you reduce it and your weight is reduced by 10 to 15 kg, then to maintain that weight, which is again a very difficult scenario, you should have reduction in calories as well as exercise. But in these studies, exercise was not given much importance. Thank you.
Yeah.
Thank you.
Dr. Convert to final word, and we have about 2 minutes left.
Everybody presented very well, and the most important aspect of nutrition in diabetes has not been discussed many of the in forum, and we discussed, and as Dr. Bharat Pandya was also posted in the chat box, very nice discussion. Everybody enjoyed the session. Thank you all of you, particularly Ashok sir also participating in the discussion, and I hand over this session to the organizer.